All right, so here at First Intermission with Dr. Jessica Wang Memoli, and we're talking about lung cancer. Doctor, thank you so much for joining us. What are, to lead us off, some of the most important facts that you want people to know about lung cancer?
Yeah, that's always a tough one because lung cancer, is so prevalent in the country. I think there's some big facts for people to know. Lung cancer is the most prevalent. It's the leading cause of cancer death in the United States. It far exceeds breast cancer and any other cancer across the board, although it's the third most commonly diagnosed cancer, which means that it tends to have a bad outcome when people get it. And I think that's a really big fact that people need to know, sort of how prevalent it is here in the United States. And then the other big thing is, it has this stigma that it's always these smokers. Oh yeah, people did it to themselves, right? They smoked, they're going to get lung cancer. But about 20% of lung cancer deaths are in non-smokers. So it's something that people have to be aware of, even if they've never smoked.
And you talk about the prevalency of it, but maybe some specifically the causes and beyond smoking, perhaps, that we can talk about.
Yeah, obviously, as everybody knows, smoking is this sort of leading big risk factor for people. But there's other things that people are exposed to just on a day-to-day basis that they may not even be aware of. Radon in your house, for instance, especially in this area with lots of sort of our rocky environment in basements that can elevate the radon levels, especially in people's basements. So if you haven't had a radon check in your basement, you should. There's also occupational exposure. So people who have worked in certain industries maybe have been exposed to things like asbestos or other inhalational things that can irritate the lungs, and that irritation can lead to different mutations that may lead to lung cancer. So there's a lot of different both environmental and occupational exposures that people have to be aware of. And then family things. Family members who first degree family members who have had lung cancer, or if they had secondhand smoke and grew up in a house where people were smoking, that might increase their risk of lung cancer as well.
So I guess kind of going hand in hand with that, I'm a non-smoker. How can I find out my personal risk for developing lung cancer?
Yeah, so that's really a tough question because we spend a lot of time, especially in our world, doing lung cancer screening. And lung cancer screening is really focused on the people who have the highest risk. So the people who are smokers between the ages of 50 and 80, who have smoked what we say for about 20 pack years. So that means like a pack a day every day for 20 years, or 2 packs a day every day for 10 years, or half a pack for 40 years. And those are really our highest risk people. However, anybody like you who've never smoked might want to talk to their primary care doctor and say, you know what, I grew up in a house with a ton of smoking, or I have 3 first-degree relatives who have had lung cancer. What are things I should be aware of and risks that I need to think about, and other things that I need to consider when it comes to what the risk for lung cancer is, sort of like any other preventative medicine.
So preventative, and then you talk about the steps you can take to find out if you have lung cancer early. How does one go about doing that?
Yeah, so if you have any of the risk factors, big thing really being the smoking, then you qualify for something called a lung cancer screening CT. And that's what we call a low dose CT. So it's not the same radiation as the kind of CT that you get because you have some sort of respiratory symptom or chest pain or something like that. It's what we call a low dose CT, so it has a little bit less radiation. And if you fulfill the criteria put out by the United States Preventative Services Task Force, which is basically people who are between the ages of 50 to 80 who have smoked 20 pack years. And if they've quit within the last 15 years. So if you smoked but quit 30 years ago, you don't necessarily qualify. But any of those people who do qualify, they can get a lung cancer screening CT. It's about a 10-minute study. You get an image done. And what that does is it really takes a picture of your lungs and helps us look for any signs or anything that looks like it could be lung cancer. And the goal of those screenings are to find people who have either early signs or any evidence of something in the lungs that could be lung cancer.
Well, Dr. Memoli, I thank you so much for joining us here. This has been very insightful, and thanks very much. That was great.
You're welcome.